My name is Laura Scordino. I'm an orthopedic surgeon. I practice in Albany, New York, in a mid-sized private practice group. I do upper extremity. I did my orthopedic surgery training at UConn from 2009 to 2014, and then I did an upper extremity fellowship at Upstate University in Syracuse, which was my top choice. That's upper extremity and microvascular fellowship. So, UConn was really just a fantastic training facility and program. I really can't imagine a program that's better designed than UConn. I think there's a lot of great parts to it. One is just your exposure. So you have an academic center at UConn, which is, you have top-notch research capabilities, and if you're really into research, there's just like all kinds of research opportunities and research staff to help get research out. You have Hartford Hospital, which is a level 1 trauma center, which is great trauma exposure, fellowship trained trauma surgeons, and just like really good experience from a trauma perspective, which is bread and butter orthopedics. No matter what specialty you go into, you're going to be needing to take some level of trauma call, and you want to feel comfortable in what's going to come in. And UConn absolutely 100% prepares you to take general orthopedic call. It's not too much trauma where you're just like overwhelmed and that's all you're doing all the time, but it's enough trauma that you have definitely good exposure. And then you have St. Francis, which is a private practice hospital, and so you get good exposure to that setting as well. So, the thing that I think is best about UConn is just the underlying idea that it's about education and it's about trying to train orthopedic surgeons. And it's not like the residents are there to just kind of get stuff done and get work done, but it's really about how to educate them. And so from the very beginning of didactics, it's a great didactic plan that's all set out. A lot of the majority of the lectures are all by the attendings, which is really nice. The skills lab is awesome. It's fantastic for arthroscopy and cadaver labs. I think that the education is just like really at the cornerstone of what everything is all about. And the good thing, or part of the reason why I think that's so good is because the attendings are just totally invested in the education and trying to make it a great program. The attendings are awesome. You need to have people who are really well trained, which they are, and they have just like a fantastic level of expertise to teach you, but then at the same time they care, and so they're going to take the time to allow you to learn and to have like graduated autonomy as you go throughout the residency. That's the other thing that I think is huge there, is just the fact that you do get graduating levels of autonomy in the operating room, and that's how you become a surgeon, is being able to do it. So in all, I think that UConn was a fantastic training experience. I absolutely would do it again. I think that it's certainly a place that should be looked into. The other thing that I wanted to talk about is that it's just a great place to live too, West Hartford. It's a very easy place. Everybody has a car. The majority of people buy their own house, and it's easy to get to go to Boston or go to New York City, or go to Vermont and go skiing in the winter. So it's a really nice place to live. So again, UConn is a great spot that you should check out.